Hi, my name is Dr. Camelia Lawrence. I am a breast surgeon and I currently serve as the Director of Breast Surgery for Hartford Healthcare in the Central Region.
Okay, so today we're going to talk about breast cancer awareness and seeing that it is Breast Cancer Awareness Month. We want to just sit down and talk to you. And if you can explain to us what is the importance of breast self-awareness and why it is important.
Well, thank you very much for having me this afternoon to talk about a topic that is near and dear to my heart. Breast cancer is the most commonly diagnosed cancer among women worldwide. In fact, I often use the analogy that imagine going out to a brunch with your girlfriends and you're all sitting at a table. If there are a total of 8 of you seated, at least one of you will be diagnosed with breast cancer during your lifetime. So it's a very common disease, and the majority of women who develop this disease, they have no family history of this disease. They are the first in their family to develop the disease. So to put things into perspective, within the United States, every year we diagnose about 300,000 women with breast cancer. But the good news is that there is several advancement that has been made in terms of diagnosis and treatment. So we have over 3.8 million breast cancer survivors here. So people are going on to do well. But the cornerstone is early detection. Early detection is key until we identify a cure for this disease, because breast cancer, when caught early, is a very manageable disease and people go on to lead normal lives, but it has to be diagnosed at an early stage. And what I mean by early stage is when the disease is confined to the breast, that it has not left the breast, or perhaps even have not made its way to the lymph nodes or any other organs in the body. So the analogy I also share with my patients when an audience in the community when I do engage is that for your stage of diagnosis affects your prognosis, which is how well you do. So for a woman who's diagnosed with stage 0 breast cancer, that's the earliest form of breast cancer, the earliest stage of breast cancer. It is also known as DCIS, or ductal carcinoma in situ. These women, the overall survival at about 5 years is like 99 to 100% of these women are surviving and doing well. They go on to live their lives. In contrast to a woman who present at later stage, let's say stage 4 disease, and that's disease that's left the breast, it's made the way to the lymph nodes, and it's made the way to other organs in the body, such as the liver or the bone or the lung. The 5 year survival for that subgroup of patient is only 25%. So look at the big drop from 95 to 99%, and now you're looking at 25%. So early detection is key. Early stage of diagnosis dictates your prognosis. So what can women in our community do? Well, they can be vigilant. Breast cancer can present in many ways. It can present as a lump in the breast. It can present as skin changes. It can present as nipple retraction. It can present as just a dimpling in the breast. But the most common way in which breast cancer are picked up is on mammography. And that's why screening mammography is so important. So women really need to go and get their mammogram done, because sometimes breast cancer can present as little dots of calcifications in the breast, or just a change in the distortion of the breast tissue, which even myself as a surgeon, I can't appreciate it on exam. So a woman is definitely not going to appreciate it on exam by herself at home. But if she's going in and she's getting her mammogram, that abnormality will be picked up at its earliest, smallest size when it's most manageable, hopefully. So the current screening guidelines is that for every woman in the United States that's age 40 or older, you should be getting yearly mammogram. And if you have a family history of this disease, your screening age may be even earlier. So it's important to have this conversation with your doctor. If you have a family history, am I a candidate for genetic testing? Because there are certain mutations that may increase a woman's risk of breast cancer. The two most commonly known mutations that we're familiar with are the BRCA1 and 2 mutation. And a few years ago, it was very popular in the media because Angelina Jolie actually has it, the actress. And she was kind enough to share her story, which prompted a lot of media publicity about the issue. And because we know women with BRCA mutation had such a high risk of breast cancer, their risk reducing things they can do and their screening mammography age actually starts at 25. So it's very important to know your family history. It's very important to ask your doctor those important questions if you do have a family history, but also keep in mind that the majority of us who develop this disease, we have no family history. I'll stop there and give you a chance to chime in.
So, are there any contributing risk factors that could possibly lead to breast cancer?
Well, the most common risk factor is by virtue of being a woman, and age. Breast cancer remains a disease of more mature women. The average age for us in our state, in the state of Connecticut, is age 61. But increasingly, we are seeing younger women with breast cancer, and particularly so in Black women. Black women are twice as likely to die of this disease, and it is multifactorial. One has to do with the stage of diagnosis. We tend to be diagnosed at a later stage. So the later the stage, the prognosis is less bright, so to speak. The other has to do with access to get into care, as well as the recommended treatment. The management of the breast patient extends beyond surgery. It's really, to be honest, at least a three-prong approach. So surgery is a component, but many women need radiation. Many women may need chemotherapy. In order for you to benefit from the treatment, you have to go through all the arms of treatment. You can't just do surgery and not do radiation if it's recommended, or not do chemotherapy if it's recommended. You really need to do all three arms. The other part of it has to do with the biology of the tumor. You perhaps have heard the terminology triple negative breast cancer. Triple negative breast cancer is a more aggressive type of breast cancer. There's also an increased risk of local recurrence of the disease coming back in the breast, as well as an increased risk of distant disease, which is disease in other organs outside of the breast. And it is more common in Black women than it is in non-Black women. So there are many factors. Weight, obesity plays a role, not just with breast cancer, but for all cancers. Obesity increases the risk for cancer. So it's very important for us to maintain a healthy body mass index, because weight gain is a predispose is a increases a woman's risk of breast cancer.
So, so do you think the late detection in Black women is due to some type of reluctancy or maybe lack of medical insurance?
It's a combination, right? So it has to do with access. And this is where I say cultural humility comes into play, is really entering these spaces to find out what are the underlying factors. One has to do with fear. I know I can tell you oftentimes when I go out in the community, I hear so many horror stories about mammogram. Oh, I heard it's painful. My grandmother had this, and it was painful. And about 4 years ago, I had my mammogram done, and I had it televised nationally, so that women can see that you can have a mammogram done. It's not as uncomfortable as it's made out to be. There are a lot of myths around mammography, but it saves lives. That's the bottom line. It saves lives. So it may be a minute or a second, a few seconds of compression to get a good picture of the breast, but your life is worth it. It's worth you having that picture done to see if there's anything there that is concerning for malignancy. The other piece of it has to do with access, as you mentioned, having easily accessible spaces where women can get their mammogram done. And this is where socioeconomics comes into role, right? We're talking about those who are underinsured or uninsured women not being able to have access to screening. It also has to do with a lack of awareness and about the disease itself, which is why I always welcome opportunities such as this one to have the conversation with those who are able to listen and to learn from it, because knowledge is power, right? And knowledge translates into vigilance. And the more women that we can get to understand the importance and the value of getting their mammograms done, the more we're going to be able to make progress towards it. But when it comes to uninsured, I will say within the state of Connecticut, there are several programs that are affiliated with different institutions where a woman who is uninsured or underinsured and meets a certain income guideline, she can get a free screening mammogram done. So be sure to reach out to your local health clinic and hospital facilities, because the National Cancer Institute has grants, and this is money that is deployed to each state throughout the country. In Connecticut, it's called the Breast and Cervical Cancer Screening Program.
Now, how often should So the woman get a mammal screening.
A mammogram screening is recommended once a year. If you have dense breast, which is a common question I encounter, which what dense breast means is that the breast, let's talk a little bit about the anatomy of the breast. The breast is made up of fatty tissue, is made up of fibrous tissue and other sort of ligaments, so to speak, for lack of a better term. And women who have more fibrous tissue, when you take a mammogram picture, the background is very white, so to speak, on the x-ray. What else shows up in the breast is white? Cancer. So a woman who has a dense breast, a lot of fibrous tissue, you take a mammogram, the cancer can easily blend in with that white tissue, right? Versus a woman who has a fatty replaced breast. When you take a picture of that breast, everything shows up black. So breast cancer shows up as white. So white in a black background, you're going to pick it up more easily. So in women who have dense breasts, because it can sometimes be more difficult to identify the cancer mammography, the current recommendation is that you should add a mammography. You should add an ultrasound rather to the mammography. It cannot replace the mammogram, but the ultrasound is an alternative way for you to evaluate the breast tissue to make sure you're not missing an abnormality within the breast because the breast tissue is dense.
So, is there any preventative measures one to take to fight against breast cancer?
There is not much that you can do other than what we just talked about regarding diet, exercise, maintain a healthy body weight, avoiding tobacco use. We know that tobacco use increases a woman's risk for just about any cancer, not just breast. But because we don't know what caused the majority of breast cancer, it's very difficult for you to pinpoint and say, well, don't do this and you won't develop breast cancer. And we're all susceptible to the disease. And to be honest with you, this is just my opinion, is that the cause of breast cancer is most likely multifactorial. So with some environmental contribution from our food, our environment, combined with whatever baseline genetic predisposition we may have. But we don't know what caused the majority of breast cancer. We just don't know.
Now, I know that there is a small percentage of men who also get breast cancer as well.
Absolutely. While less common among men, men do develop breast cancer. In the United States, it's about 1 to 2% per year, which equate to about 3,000 men annually who develop breast cancer. Um, but of course, we don't have any screening. We don't tell men to get screening mammogram. And men don't really have breast, the majority of men per se. So typically when a man present is one, they've had some sort of changes. Either they've had like a nipple discharge or they've felt a lump within the breast that has led them to seek medical attention. So I think the message here this evening for men is that yes, you too are susceptible to developing this disease. And if you notice any abnormality within the breast, a dimpling, a nipple discharge, a lump that wasn't there before, have it checked out. It's better to make sure than for you to have something there that's further developing and could potentially be diagnosed at a later stage.
So that leads into my next question, in terms of what type of treatment options are there for someone who has breast cancer, and does those same treatment apply to men with breast cancer as well?
Correct. So it's the same treatment. The options for management of breast cancer are one, surgery is usually needed in just about all cases, unless the patient presents with advanced stage disease where the disease is beyond the breast. If the disease is in multiple or any other organs outside of the breast, removal of the breast has not been shown to improve overall survival. So unfortunately, I will tell you, I do have patients who I see they present with a mass within the breast. They may have had it for 6 months. Some told me you have it for a year. They didn't think it was anything, so they didn't make a big deal about it. And by the time they get to me, the disease is already in their liver or it's in their lung. Those patients are not candidates for surgery, but they're candidates for chemotherapy. And we have novel treatments, chemotherapy drugs that can really prolong a woman's life with breast cancer, even though she's diagnosed with advanced stage disease. Um, there's some women, for example, women who undergo an lumpectomy, which is just removal of the part of the breast with cancer. The majority of those women do need radiation, and a subset of those women will need chemotherapy as well.
So it sounds like early detection, the survival rate is a higher rate of survival.
Correct. Yes.
So early detection is key.
It's paramount. And that's why I strongly encourage women, get that mammogram done. You don't know what you don't know. And so if you don't get your mammogram done, you don't know what's going on there. So my hope is that, whoever is listening to this podcast is that you'll never have to cross this bridge, but you don't have control, just like me, you don't have control over whether you cross that bridge or not. But what you can do is can arm yourself with knowledge and do your part. And part of doing your part is making sure that you get that screening mammogram, making sure you schedule that doctor's appointment if you notice a change in your breast. And if you have a change within your breast and it's something that it just doesn't sit well with you, and you see one clinician, it's still there, it's getting bigger, you're told not to worry about it, get a second opinion. It's so important for women to advocate for themselves. The majority of time, when an abnormality is seen in the breast, we no longer take patients to the OR. The majority of patients can have a needle biopsy, whether it's an ultrasound or a stereo biopsy, but they can have a biopsy done in an outpatient setting by a needle. They don't have to go to the operating room. And that biopsy can clinch a diagnosis. It can tell you whether this is something benign and nothing else needs to be done, or whether this is a small early cancer that's starting and you need to have an operation for it.
So as of today, the best tool against breast cancer is awareness and
And
early
early,
detection.
correct, is awareness, know your risk. Every woman by age 30, I often say, should know what their risk is. Are you average risk or you're at an increased risk? You're most likely at an increased risk if you've had multiple family members with breast or ovarian cancer. That suggests that there's something potential underlying genetic abnormality that may increase your risk. And there are patients who they may have genetically tested and no mutation is found, but they still have multiple family members who've had breast cancer. Your family history by virtue increases your risk if you have multiple family members of having breast cancer. And this information is important because you're considered higher risk. So, for example, within Hartford Healthcare, we have a breast high risk surveillance program. So, these are women who've presented to our facility. They have shared that they have a strong family history of breast cancer. They may or may not have had a mutation identified, but because their risk is greater than 20%, they're now enrolled in our breast high risk surveillance program. And what that entails is that that woman is being followed much closer because her risk is higher. The American Cancer Society recommends that if a woman's lifetime risk for breast cancer is greater than 20%, that they should be followed with MRI in addition to mammography. So I welcome these women to be proactive about their health, know your risk if you're at an increased risk, enrolled in such a program so that you can be followed closely, so that should there be anything developing, that it would be caught very early. Because until we find a cure for this disease, our best ammunition is awareness and early detection. I often say, because the problem is so ubiquitous within our community, and especially, Black women in particular, like I said, we're twice as likely to die for the disease. If you or someone you know and you're diagnosed with breast cancer and you need to get in to see somebody, reach out. My office number, or you can text me. I'll even give you a cell phone to text, and that's reach out. I'm at the breast center, or reach out to your local breast center, whatever is closest and most convenient for you. But definitely reach out, get the help that you need. And the last thing I'll say is this is not your fault. This is not a secret. This is not something to hide. This is not something that you did wrong that led to this. This is not something that you went and bought at the store. So there's no shame that or stigma that should be associated with being diagnosed with breast cancer. So definitely talk to folks who who have walked the journey. It's a disease that once diagnosed, you do need a support system. You need a village to help you navigate the different arms of care that you will need. But it's a treatable disease. It's a very manageable disease. If you are diagnosed early stage, it's very manageable. Women are going on to live magnificent lives after being diagnosed with breast cancer.